Welcome to Mercy Medical Center's live webinar. I am Lynn Harmon, Program Coordinator, and today's topic is adolescent self-harm. Joining us is Katie Moon, Counselor, and Aneta Rysz, Intern at Mercy Family Counseling. After their discussion, they will take questions from our audience. To submit your questions after the webinar, hover your mouse over the green bar at the top center of your screen and then click on the Q&A icon at the far right of the strip. If you don't see the icon, click on the arrow at the very far right and click on Question and Answer. Do not click on the chat icon. Then from the drop-down box, type in your question. Your questions will be confidential. Well, I'm very happy to welcome you both to our webinar this morning, and I'm going to turn the mic over to Aneta now so we can go ahead and get started.
Hello, my name is Aneta, and I am a grad student at the University of Iowa in Rehabilitation and Mental Health Counseling, and I will be graduating in 2 weeks now, so I'm pretty excited. I have been with Mercy for 5 months now as an intern, and today I am really pleased that we're gonna raise awareness about the topic of self-harm. I think for both and everybody in this room, it is an important topic, and we would like to just have that conversation and discuss some biases that maybe some people might hold. First of all, I would like to talk about some statistics. When I started working on this project, I was amazed by the statistics, and also I have a better understanding now where is this coming from and why why I was so unaware of this situation. So approximately 1 in 5 females and 1 in 7 males engage in self-harm, and 60 of those who self-harm are females. Approximately 90% of those who harm themselves began in the pre-adolescence or teen years. When we researched this project, we started looking at some papers, and one of the papers said that the onset was 15 years old, but I just want to mention that that age, it might be a different onset because we still see that kind of population in the earlier ages, like 12, 13. Another problem that what we would like to start on is the definition of self-harm and what it really is. So self-harm is anything that a person does intentionally to injure himself or herself. Most of the things that happen or when people self-harm, it is a way of expressing and dealing with deep stress and emotional pain. And one of the studies that it was written by Whitlock in 2014, the data said that 50% of those who self-harm, they had uncomfortable feelings, and 43% they self-harmed in order to release stress or pressure. So those who self-harm often report that the action brings them relief. That's the only way for them to feel, to cope with intense negative emotions such as sadness, self-loathing, emptiness, guilt, and rage. But nevertheless, one of the important topics that we would like to introduce is to have you differentiate self-harm from suicide attempts. There's a difference between those attempts and different intentions. So a person who experiences suicide ideation, those attempts are in order to end all feelings. And people who have suicide ideation as well, they're considering suicide. They might talk to you about having those thoughts or maybe considering suicide attempt. Often those suicidal thoughts are seen as a cry for help, and they're hoping that someone will intervene and help them to reduce the intensity of those suicidal thoughts. Nevertheless, on the other hand, self-harm is a way of seeking temporary relief from pain, and it's not a way or people who self-harm, they don't want to end their life. It is a way for them to hide. After they self-harm, they often try to hide their behavior. They're really ashamed, and they feel a lot of guilt after experiencing or attempting to self-harm. And they're not very clear warning signs because of the isolation that people who self-harm experience. It is really hard to notice that someone is doing self-harm. So most importantly, I just want to emphasize that it is important that we assess the intent of the behavior, which can be very different. It can be either self-harm or suicide. Nevertheless, we never can say that we really have to look for specifics and the intentions of an individual, and it's very individually, we have to individually address. We would like to address some myths and facts about self-harm. These are not the only things that we mentioned, but these are the most common. One of the myths that people have in society is that those who self-harm and self-injure are trying to get attention. The truth is that people who self-harm are generally doing in a secret, as I mentioned already, but they're not trying to manipulate others or draw attention. They really experience fear and shame after they attempt to self-harm. Another myth is in the society is that people who self-harm and injure, they are crazy and or dangerous. The truth is that people who self-harm, yes, they suffer from anxiety and depression or trauma, but self-injury is for them as a way of coping. So we have to keep that in mind before we even assess that. Another myth that we hold is that people who self-injure want to die. Well, the truth is, and the fact is, that people who self-injure usually do not want to die. They really are trying to express their emotion, but their coping skill is not as positive as we might think and we would like. So they're not trying to kill themselves. It is self-harm. It is a way of helping them to live. Last and not least, myth that some might hold is if the wounds aren't bad, it is not as serious. And having said that, I just want to emphasize that we cannot assume just because people have minor wounds that there's nothing to worry about. We have to consider each case individually and look at the evidence and support or maybe causes for self-harm. It is important to understand that self-harm is correlated with a lot of mental health problems. One of them is depression, and one of the symptoms of depression is loneliness and isolation or hopelessness. Those who self-harm, they also have tendency to have perfectionistic point of view, and sometimes they cannot resist their impulse, so they are more likely to be impulsive, and some of them, they might have impaired family communication, so not having good conversations or even a contact with their family members, it just puts them into isolation, which might lead to self-harm. They also have higher anxiety level. They tend to self-blame, and they have lower self-esteem. Some of them, they have hypercritical parents, and also they are more aware of self-harm by peers. But I also want to emphasize the fact that those who self-harm, they are not doing it just because someone does it. And the study that I mentioned before, the statistics said that just 2.5% of those who were self-harming were doing it just because someone else did it. So I just want you to be aware of that and keep that in mind because we don't want to send mixed messages about this topic. They're specific, or there are life factors that may contribute more than the others to self-harm. One of them is childhood sexual physical abuse and subsequent post-traumatic stress disorder. So those who experience extreme trauma or trauma, they are more likely to self-harm. Also, those who were sexually assaulted or maybe raped are more likely to self-harm. As I mentioned before, anxiety and depression is one of the contributors or likelihoods, increases the likelihood of self-harm as well. Loss of parent or maybe recent loss, so those extreme emotions when we all of a sudden lose something that is really important to us. Childhood illness, marital violence, and familial self-injury. But I just want to re-emphasize, just 2.5% people have that way of thinking or maybe way of coping. Another thing is that people might experience peer conflict, social pressures, bullying, or maybe intimacy problems. Those are also contributors for self-harm. Poor self-esteem or self-image, as far as we know, teenagers experience that quite often. We remember as well how we felt when we were teenagers, so please keep that in mind and take their perspective as well, even though it's really hard, but that's the reality. And as I mentioned before, impulse control problems, these are the things that also may contribute to increased self-harm. So the reasons that people do self-harm, it's perceived by those to feel concrete pain when psychic pain is too overwhelming. So just to give you an idea that when we feel emotionally too overwhelmed, it is much easier for us, or for some, to express those emotions. Self-harm also helps to reduce numbness and promotes a sense of being real. So it brings us to, it may help to bring the real or experiencing emotions. It keeps traumatic memories from intruding into conscientiousness, and when we think about those traumatic events that happened, it is much easier, or it's a way of coping for some that self-harm. For some, it might be a way of receiving a support, or caring from others, or maybe gaining a sense of control because those things that happened to them in the past are too overwhelming, and self-harm might be seen as a sense of control over those emotions that we experience. Some see it as a self-punishment for perception of being bad, and some of them, they just wanted to fit in. And now I'm going to turn into Katie, and she's going to introduce herself, so please.
Good afternoon. I'm Katie Moon. I'm a counselor with Mercy Family Counseling. And as Aneta said, we're happy to bring this topic to light because I think it's often misunderstood, and I feel that it's important for people to get some accurate information because it's a pretty sensitive issue. So moving along, These are some quotes when we were doing our research that we found that people who actually do engage in this behavior had tried to attempt to explain why it provides relief to them. I think it's hard to understand how harming yourself and how feeling physical pain could be a relief, but these quotes we're hoping helps to make that a little bit clearer. So one person had said, it expresses emotional pain or feelings that I'm unable to put into words. So the pain is so strong, but they're not sure how to communicate that verbally. Another person had mentioned it's a way to have control over my body because I cannot control anything in my life. When we look back at some of those risk factors, you know, sometimes there's chaotic family life or problems with peers or, you know, trauma in the past. And so sometimes these adolescents feel like, you know, things go on around them that they can't do anything about. And this is something that they do have control over, and they feel like they need to take back that control. Another individual mentioned, I usually feel like I have a black hole in the pit of my stomach. At least if I feel pain, it's better than feeling nothing. Aneta had touched on that earlier, that sometimes people feel that they're not real, that they don't really exist, and the pain is a concrete reminder that they are still real. And finally, I feel relieved and less anxious after I cut. The emotional pain slowly slips away into the physical pain. There are several theories concerning the etiology of this behavior. As with most things in mental health, there isn't always a clear-cut cause or root of why some people engage in this behavior and why others don't. Clearly, issues like depression and anxiety are widespread, and obviously not everybody who experiences those things also engages in self-harm behavior. So again, these are theories, but we're not claiming that we know exactly why somebody might do this and somebody else doesn't. The biological perspective has to do with the serotonin and endorphin systems, which they feel might actually make self-injury like an addiction. And oftentimes when talking to an individual who engages in this type of behavior, they do feel that it's an addiction, and they'll describe the behavior similar to what you would describe a problem with alcohol or drugs. You know, they'll say things like, you know, I didn't want to, I tried not to, you know, and they'll tell you how many days it's been since they've self-harmed, again, similar to the way that other addictions often work. The psychosocial perspective just suggests that people self-harm to regulate their emotions. Again, we had touched on that earlier. The emotions kind of feel like they're out of control. People react very strongly to things, and they don't know what to do with those emotions. The physical pain that they experience helps them to feel real and helps them to be able to sort through their emotions. The psychodynamic perspective suggests that, you know, this is anger that they might feel externally that instead they turn internally. They turn it towards themselves instead of expressing it externally. And then the biosocial emotional dysregulation perspective suggests that people who self-injure might have an inability to distract themselves from their emotional experiences. So when they experience some kind of intense feeling, they don't know what to do with it. Basically, they can't focus on anything else, and that feeling becomes overwhelming. So the person uses the self-injury as a way to try to cope and deal with those really strong emotions because they haven't figured out a better way to do that yet. So you can see some of these are very similar, and again, we're not claiming to know exactly why one person would choose to do this and somebody else wouldn't, but these are some theories that might help you to get a little perspective. When we refer to self-harm, I think people usually assume that means cutting, and you know, I've even heard the term, oh, he's a cutter or she's a cutter, and that certainly probably is the most common type of self-harm behavior, but it definitely isn't the only one. And as Aneta mentioned, you know, just because it's not a very severe injury or cut, not assuming that it's not a severe problem. So even somebody that uses like a paper clip or a staple or some other somewhat sharp object to scratch at their skin, that still could be a self-harm behavior. Other types of self-harm behaviors include burning or scalding. I think most often we would see burning like with lighters or cigarettes. Hitting or banging their head, punching things or throwing their body against walls and hard objects, sticking objects into the skin, intentionally preventing wounds from healing, so, picking at the scabs or, basically not caring for a serious wound. Swallowing poisonous substances or inappropriate objects. Pulling hair from their head or from other parts of their body. Here's some warning signs, things to look for, and certainly these are not inclusive, but these are some things that would be good to notice, especially if you have somebody in your life that you're particularly concerned about. Unexpected or unexplained wounds or scars, so the person might have, a pretty nasty cut, and they can't really tell you how they got it, or their explanation doesn't really seem to fit. Blood stains on their clothing. The presence of sharp objects or cutting instruments. So, again, if that person has like a lot of knives or scissors or razors that they are keeping with them or keeping in their room, that would kind of be a red flag. Frequent accidents or infections. So again, like a cut that won't heal, or, asking somebody, oh, what happened? And they're saying, oh, I fell, or, accidents that don't really seem likely. Covering up, we tend to see this one a lot. Wearing long sleeves and pants even when it's not weather appropriate. So the person may be in a very warm room with a sweatshirt on and refuse to take it off. Or in the middle of the summer, maybe wearing pants because they're trying to hide the scars or the cuts that are on their legs. Needing to be alone for long periods of time, or requesting to be alone. This would be like the adolescent sitting with their door closed, for hours at a time. Again, it's one of many things to look for. Certainly, isolation in adolescence isn't unusual, but if this is happening more often than not, it could be a sign that there's something else going on. Isolation from others and irritability, so even isolation from peers, friends, activities that they used to enjoy. An increase in their depression or anxiety symptoms, drug or alcohol use, or other noticeable changes in their mood or their behavior. Things like, if somebody used to be very active and now they're just wanting to stay home, or they were, pretty happy and, always in a good mood, and now they're very quiet and withdrawn. Or somebody that used to get along with everybody and now is very irritable. Those sudden changes that are kind of unexplained, that aren't caused by something else. Here's ways that somebody can help. And these are pretty general, but I think whether it's an adult talking to the adolescent or even a peer talking to the adolescent, I think these guidelines can be helpful. So it's most important to learn about the problem, to ask the person questions, and don't assume. There is kind of this judgment, I think, in our society against people that self-harm. There's a negative image or a negative stereotype about what type of person they are. Again, there's that term that has that negative connotation, cutter. Don't assume that you know why the person is doing this until you get the facts. So encourage the person to communicate with you, listen without providing judgment. Often our knee-jerk reaction is to say, well, that doesn't make any sense, or why would you do that? That certainly isn't going to encourage the person to talk to you more about it. Offer support, not ultimatums, threats, or punishments. Unfortunately, I think a lot of parents feel that if they, take things away or take away privileges, that will enable the person to stop self-harming, and really that often does the opposite. That often makes the problem worse. So, a lot of times people are ashamed of this behavior as it is, and an ultimatum or a punishment doesn't help them to figure out how to deal with it. So helping the person to identify the stressors and the triggers, so, looking for patterns, looking for particular things that tend to precede the self-harm behavior. Helping the person to increase emotional awareness and to communicate their feelings. As we saw before, most of the time that tends to be what's at the root of it, is that the person who self-harms doesn't know how to get in touch with their emotions, and if they do, they don't know how to deal with them. So teaching other healthy ways of managing overwhelming stress and emotions, healthy coping skills, teaching them to get involved or get distracted when they're feeling overwhelmed by stress. Staying in contact. So, if you have this conversation with somebody you care about, make sure you go back to that person and say, how are things going? What can I do to help? You want to communicate that you do care and that you're concerned. Having the conversation just once probably isn't going to be enough. So next we want to talk more specifically about what can parents do about somebody in their life that is self-injuring, and then what can teenagers who are engaging in this behavior do about it. So first of all, for parents, talking with their children about respecting and valuing their bodies. Hopefully this is a conversation that has happened, more than once, and hopefully before the self-harm behavior even began. Even very young kids are taught about respecting their bodies and valuing who they are as a person. Being a role model, showing healthy ways of coping with the feelings and managing stress. So if the teenager can look at you as the parent and see that you know how to deal with stress, or that you have healthy ways of coping with things when things are overwhelming, they're more likely to mirror that behavior. Spending time together as a family, this communicates that not only do you care about them, but it also removes them from that isolation that they might be feeling. Have the teen be in charge of selecting and planning family activities. I think it's pretty common that teenagers, don't necessarily want to spend a lot of time with their family, so if they have a say in what gets done and when, they might be more willing to do that. Solving family problems as a team, so if something happens within the family, when possible, using a team approach to figure out a solution, rather than just, as a parent, always coming up with a solution. Helping the teen to feel appreciated. Focusing on the positives. We talked earlier about, a lot of times people who engage in this behavior have what they would define as hypercritical parents. Parents would say, okay, well, you got to be on that test. Why didn't you get an A? Or parents that, would say, okay, well, you got a home run, but then you struck out the next time. So trying to focus on the positives. I think a lot of times those positive things get missed, and it's easier to focus on the negatives. And being consistent as a parent, just in general, the rules and the expectations should always be the same. The consequences should always be the same. For adolescents that really want to stop this behavior but are having trouble, find some ways to make the present moment more tolerable. So, distracting yourself, turning on some music, calling a friend, turning on the TV, just something to make the present moment more tolerable. Identifying the feelings and talk them out rather than acting on them. So if you're feeling emotionally overwhelmed, try to figure out what it is that's causing you to feel that way and find somebody to talk to. And if you can't find somebody to talk to, you can write them down. And we'll talk about that one in a minute. Notice the triggers and avoid them if possible. Unfortunately, sometimes as an adolescent, there's many things that they need to do that they can't avoid, like going to school, like interacting with their peers at school. Those are things that unfortunately we can't remove from their environment. But there may be certain people or certain places that can be avoided. Friends that are, maybe not very good friends, or friends that have deceived them or treated them poorly in the past. Those might be things that could trigger this behavior that could be avoided. So again, distracting themselves when they have the urge to self-harm, coming up with a list of distracting activities ahead of time would be a really great idea, because in the moment, again, it's kind of like an addiction and it's an impulsive choice, and it might be really difficult for them to figure out what to do when they have that urge. Journaling, again, it doesn't have to be perfect, just writing out whatever feelings or thoughts are on your mind just to get the emotions out. Find ways of soothing themselves, so, taking a walk, doing some relaxation breathing, taking a hot shower, something that makes them feel more calm. Practice positive stress management. There's a lot of different ways to do this: regular exercise, healthy relationships with peers, talking to people when you're feeling overwhelmed. All of these things will help. And improve social skills. For many adolescents, if they had a friend or, a group of friends that they felt really understood them and were there for them, that might make a big difference. In doing our research for our presentation today, we came across a few resources that I thought would be really helpful to pass on. And so if you want to make note of these, that might be helpful. There actually is a national self-injury hotline. and it's 1-800-DON'T-CUT. You know, it's 24 hours a day, 7 days a week, and the actual number is down there as well. But that could be a great resource for an adolescent or for an adult. You know, we've been focusing on adolescents, but certainly self-injury is not a topic that is only limited to the adolescent population. There's actually a really great website. It's kind of a long one, but it's adolescentselfinjuryfoundation.com. I found a lot of really great like handouts and some like sample conversations and just some really great resources for both parents and adolescents on that website. There's also the Youth Suicide Prevention Program, and again, you know, we did differentiate between suicide attempts and self-harm, but this website does have information on both. And then, of course, us at Mercy Family Counseling, our phone number is there. And then also on this next slide, I have our address and our phone number. So if you have somebody that you are concerned about, definitely give us a call, and we would be happy to help you. Thank you for listening.
Well, thank you both for sharing that information. And for our listeners, I want to remind you that your questions can be submitted by hovering your mouse over the green bar at the top of your screen. Okay, the first question is long. I just read over it, but I think we'll go ahead and one of you will take this. The question is, we just found out a few weeks ago that a daughter had been cutting for a while. They've started her in therapy, but the parent is asking, she's read many stories where kids say they just told the therapist what they wanted to hear. How do we know when she's opening up and to the therapist? So I think, Katie, you're going to take this question.
Thanks for your question. I think definitely this is a question we get very often, not even related just to this topic, but when you have an adolescent in therapy, there isn't necessarily a way to know that they're sharing what you as a parent would like them to share. My suggestion is to be an active part of that counseling. If you're able to, if your daughter is willing, you know, to have some contact with the therapist, you know, even at the beginning or the end of the session, to make sure that they're getting the accurate information. The other thing that I would suggest is also to do what you can for your daughter yourself at home. You know, the therapy certainly is important, and you know, that's a great place for her to be. But if you're concerned she's not communicating with the therapist, you know, trying to communicate with her at home in terms of, you know, how is she doing with that behavior? Is she feeling successful in her ability to stop? What can you do as a parent or as a family to help support her? Because certainly therapy is not going to be the only thing that's going to help her be able to kick that behavior. So definitely being involved in that process. And again, it's a touchy subject because adolescents want to feel that they can trust their therapist and they don't always want their parent involved. But as a parent, you have a right to some information and to have contact with that therapist. So I would suggest going in at the beginning or the end of the session with your daughter just to make sure that everybody's on the same page.
Okay, next question. Is there any correlation between where a person self-harms and the severity of the condition? The question is is it hiding more than others? For example, the forearms versus the hip or ankle. And I think Aneta's going to take this question.
So as far as my understanding and my experience, and also Katie as well, there's not have been any correlation between severity of the condition and the places that people do self-harm. If it's a forearms or hip or ankle, it is just a way of, I think for those who do it, it's a way of expressing their pain and for them it's just maybe a preference, but at the same time it doesn't really matter. It's just a matter of the action. Sorry.
We've had a couple questions asking if there's a way to get a copy of this PowerPoint, and yes, this the entire webinar will be posted on Mercy's website, and after our question and answer time, we'll have that website up on the screen. Okay. The next question, I've heard of copycat suicides among teens, but do you ever see copycat behavior for self-harm?
I think with many adolescent behaviors, you know, there does tend to be like copycat, or there does tend to be, you know, similarities in a peer group. You know, I don't think there's been any specific research done on this topic, but my guess is that there certainly are some people that self-harm because they've seen a peer that has self-harmed, or they've heard about a peer that has self-harmed. But also, I don't think that that would be the only reason that somebody would choose to self-harm. That may be what kind of tips them over the edge in terms of actually trying the behavior. But most of the time, if a person is self-harming after they see a peer do it, there probably still is some underlying, or still are some underlying concerns such as depression or anxiety. You know, it wouldn't be something that they would just experiment with without probably having some underlying condition as well.
Okay, next question. I'm concerned about bringing up this subject with my daughter. Can you give some specific examples about what to say to her when I first talk with her about it? Okay, Katie's going to take this question.
As we mentioned, I think the most important thing is to go into that conversation with an open mind, without any assumptions and without any judgment, which as a parent can be difficult to do. But I think you want to ask questions and find out information rather than making accusations or assuming that you might know what's going on when you don't. So, you know, I would maybe start by saying, you know, I've been concerned. I've noticed that you've had some cuts that you haven't been able to explain. You know, I'm concerned because I've noticed your grades are dropping, or it seems like you're spending more time in your room. You know, I really want to know if there's something else going on. I want to listen if there's something that you'd like to talk with me about. You know, just being as open as possible is going to help. If an adolescent feels like you're going to judge them or punish them for the behavior, it's very unlikely that they're going to open up to you.
We have another question, which I think, just to narrow it down, is basically, is depression hereditary? She's talking about family members, and then I think from that, self-harm. Do you see any hereditary conditions with this? And I think Aneta's going to take this question.
Regarding this question, as far as you know, there's a theory regarding the nature versus nurture, and yes, research shows that there is a hereditary component, I'm sorry, I'm blanking, component if it comes to depression. Nevertheless, I have not seen or came across any of the research that suggested that self-harm is hereditary as well. So for some, it might seem as a way of coping skill and not as a component of hereditary condition.
Next question, are you aware of any support groups at Mercy or online? Okay, Aneta, I'm going to turn it back to you again.
So as Katie already mentioned, we put out some Mercy counseling info, but also what we have or we have to be aware of when we look at those websites that might seem as supportive or support groups. Nevertheless, we have to keep in mind that a lot of, not a lot, but some of the websites also present some ways of hiding the behavior or learning about the behavior even more. So we have to keep in mind that having that in perception, or keeping in mind that there's some ways that people might think it will be helpful to look online and see how to, just hide those self-harm behaviors. It is really important to also look at the fact that, yes, there are some that are helpful, like Katie mentioned, but also we have to keep in mind that there are some that might be just promoting the behavior as well. So.
Changing the topic a bit, but will insurance cover treatment for self-harm? And I'm going to hand this to Katie.
Well, because self-harm tends to be an expression or a symptom of a different disorder, such as anxiety, depression, or PTSD, again, certainly somebody would not come in to our clinic just because of self-harm. There is more than likely some other underlying issue, most commonly like depression or anxiety. So insurance does cover counseling for depression and anxiety. Specific to your own insurance plan, you definitely would want to check and see what benefits you're entitled to for mental health treatment. But counseling, usually does cover things like depression, anxiety, PTSD. But definitely you would want to check with your insurance carrier to make sure that counseling would be covered. And then again, since the self-harm is a symptom of that particular disorder, it would cover that sort of treatment.
As we begin to wind down our webinar, I want to tell you about our next month's webinar topic is What Happened to My Sex Life? Solutions to Post-Cancer Treatment. The speaker is Erin Sullivan-Wagner, a cancer coach, and this will be broadcast Tuesday, June 10th from noon to 1. And she will take questions live after her discussion also. Now, as I mentioned earlier, people asking about being able to get copies of this PowerPoint. Today's program will be available at the website at the bottom of your screen, mercycare.org/live. This is the link that you possibly registered for this webinar, and there'll be a link at this site to the archive tape of this. You can always check this website for information about future webinars, to register, as well as listening to past webinars. Now, if you're interested in future Mercy webinars or other events, you may sign up for Mercy's electronic newsletter at mercycare.org/e-news. I believe we have covered all the questions that were submitted to us, but if you have additional questions or concerns, Katie and Aneta can be reached at 319-398-6575. Thank you for joining us today.